Hi, I'm Dr. John Leonardo. I'm a board-certified anesthesiologist and a chronic pain specialist. In addition to these disciplines, I practice aesthetic, regenerative, and sexual medicine. I'm Ontario, Canada's first provider trained by Dr. Runels in the P-shot or the priapus shot. So I've been treating men for erectile dysfunction and size gains since 2016. In 2019, I introduced GROTOX, botulinum toxin for growers. It was revolutionary at the time, using neurotoxins like Botox, Dysport, and Xeomin to relax the penis so that it could hang longer in the flaccid state. I basically addressed shrinkage, and I preceded a lot of other providers by years. I've also been doing penile augmentation with fillers since 2019. My filler of choice at the time was calcium hydroxylapatite. I loved it because of its characteristics in terms of producing collagen, so you were building flesh. I authored the Penile Augmentation Chapter of Calcium Hydroxylapatite Soft Tissue Fillers Expert Treatment Techniques. And since the release of that textbook, I've really fine-tuned my technique and my filler of choice, which is a hybrid blend of calcium hydroxylapatite, which is Radiesse, and HA. You get the best of both worlds. You get that real feel texture from calcium hydroxylapatite. It's dense, it feels like flesh, and then you also get the bulkiness of HA. My technique tends to differ from other providers such that I can really minimize really severe contour irregularities. For one thing, I pre-screen patients for shrinkage just because if there's too much variation between flaccid and erect length, you're going to have an accordion-like effect. However, after pre-treating the patient with GROTOX, botulinum toxin for growers, there's less variation from flaccid to erect. Secondly, during my procedure, I inject trimix to induce an erection. It just allows for much better control and precision when I'm injecting the medication with a cannula. If you think about it, the penis often looks much different erect versus flaccid. When the patient's erect, you can really appreciate the different curves or maybe tapering in certain areas where you can augment that specifically to create a more uniform looking appearance. The way I sculpt the penis also respects natural anatomy. Some providers only inject the dorsum or the top part of the penis, neglecting the sides, or vice versa. But I want to respect the natural anatomy from every angle of the penis. The choice of filler I use is not limited to the hybrid. Sometimes we could do exclusively HA and then inject PRP on top of the HA filler, which acts as a scaffold for the PRP to form flesh because it's also regenerative. Another product we can use is platelet-derived growth factor. It doesn't require a blood draw. It can also work well with the HA scaffold in terms of forming flesh. In terms of longevity, we've had 3 patients return after 32 months and they still were bigger than their baseline. You can expect to top this off on an annual basis, maybe even a year and a half or even 2 years or so. There's longevity with the products that I'm using in terms of the benefits of biostimulation. Most of our patients return long before their product dissipates just because they love the procedure so much, they love the girth, and they just want to add on, just grow a little bit at a time. If there are any contour irregularities, often they're really minimal, where we can do a little spot dissolve, maintaining the girth, but just kind of smoothing out any kind of contour, or they wait to just come back and when we top off, we can build around it. My protocol makes the procedure very safe, it's effective, patients absolutely love it, and so will you. It's sometimes even life-changing. And despite what other providers may be telling you, there is no need for you to get a circumcision prior to penile augmentation with me. If you're interested in improving your size, getting a little bit more girth, please contact our office. You can email at info@leonardomedicine.com, or you can call 647-223-4436. I'd be happy to help you.